And now he's got his foot, but he's got a Charcot foot on the other foot. Does anybody know what a Charcot foot is? A Charcot foot is a foot that, you know how you have the arch on your foot? It goes in the other direction. It looks like a V. It's basically a dropping of your bones, and so you don't maintain balance. And it's not reversible. And you can't use special shoes to kind of heal it. It doesn't work. You then need a cane to help maintain your balance. I want to meet you guys to introduce you to somebody really special. This is Dr. Martin Ruiz. He's my partner at Life Care, and he's as passionate about diabetes as I am. And you will be working with him in our offices as you come and do your clinical rotations. Any other questions?
What about kind of like the emotional aspects, especially with somebody who maybe has just been diagnosed with diabetes? Like, I understand that blood glucose levels have a big effect on people's emotions a lot, and so like people who might be using like sugar or carbs to
comfort eating.
Yeah, like what do you do for that?
We talk to them about it. We also discuss whether they're depressed. We discuss whether they're going through a really high emotional situation, we also help them look for support. Do they have family support? I have a patient whose husband has no clue she has diabetes and absolutely demands that we never tell him. She goes to a counselor I sent her to, and she tells her husband the counselor's her friend, and they're visiting. Has no idea. So it's not an easy thing to handle when you're first told you have diabetes, but it's not the stigma it used to be. When I was in high school, my parents were trying to hide it from the world. And then I didn't have glucose monitoring. It was hiding in the bathroom to take injections in hopes I was doing it right. Now we have glucose monitoring. We have counseling. The stigma isn't there like it used to be. So there's a lot we can do. We open ourselves up to our patients. They can call me if they're struggling with it. I will sit and talk to them if they're struggling. I don't sit there and say, well, you have diabetes, now deal. No, I walk in their shoes every day, so I totally understand what they're going through and how difficult it is. I also ask them to bring in their significant others, be it their spouse, their boyfriend, their girlfriend, people that are in their family, in their life, in their social circle, so that I can see whether they do have the support they need. If not, I can hook them up with somebody that can give them the support they need. And it's not easy. It's never easy to be told you have a disease, whether it's diabetes, cancer, even hypertension or high cholesterol. It's like, wait a minute, I'm healthy. I don't feel bad. How can you tell me I have something wrong? So we have to work with them.
Well, I have one more question. That's when should you start with awareness and education? I mean, hopefully you get them before they even get into trouble, right?
We start educating them the minute they walk in our office. But now, with diabetes being such an epidemic, we should be educating our children. We should be educating our school systems to take the garbage out of the schools. We should stop encouraging the schools to contract with McDonald's and Burger King so that they can get funding for their school and they can put in their fast food restaurant in their high school cafeterias instead of cooking healthy. We ought to have apples and oranges and fruits and vegetables in the vending machines instead of Cokes and chips and candy. This is how we're going to make the changes. It's not going to be at my age. It's going to be at a very early age. We've got to start educating. I do kitchen creations for kids at Powaka Pueblo with a nutritionist there, Dolly Narang. We are starting to teach the children. But it's very difficult because sometimes parents are the most difficult people to convince, because it's easy to open a bag or a box of mac and cheese and cook it in the microwave and feed it to the kid. It's easy, it's fast, we all work, we all lead very busy, hectic lives. But it really is up to us to make those changes and stop and do. I'd rather have an unbed made than feed my child garbage. I don't care if the bed is made, but I will cook a healthy meal.
one more. That's about, you talk about portion sizes. When you go to a restaurant, I mean,
They're massive.
you're kind of used to eating whatever you pay for. I mean, you can take it home, of course, but I mean, that's going to, for a lot of people, take a lot of self-control to not eat the whole plate.
One of the things I do is I encourage my patients to share a meal. I do that with my husband all the time. Restaurants don't like it because you're only paying for one meal. But they always say, well, we're going to tack on $2 for the plate. I don't care. I'm not going to overeat just because it's there in front of me. And if I don't have somebody to share with, the first thing I do is ask for a box. And I take out what I'm not going to eat and only leave in front the small portions. I measure out on my hand. Remember, the serving size is the palm of your hand. Your palm won't work for her, her palm won't work for you. It's your palm, and that's what you measure your portion sizes out in. And that's what you should eat. Your vegetables, your meats, your starches, it's your palm. Not your whole hand, and it doesn't go up. Okay? It's right here. Any other questions?
Any more questions? Yes.
Can you speak a little bit about alcohol use and diabetes?
Makes things worse. Alcohol, when you drink alcohol on an empty stomach and you're a diabetic, you're going to crash. Okay? You can drink in moderation. Doesn't mean you can't have alcohol. It just means, again, it's part of your carbohydrates and you bring it into balance. Okay? I had a glass of wine last night, but I had no bread with my meal. I had a glass of wine with my meal. But that's what I do. I look at what I can leave out so I can have a glass of wine or a beer. I'm not a beer drinker, but I teach my patients. I tell them that limit it to one. Men can have up to 2, but they're better off. If you don't need it, why do it? Learn to do everything in moderation.
Dr. Ruiz, you have anything to add? I knew you came kind of late in here, but you want to introduce yourself real quick?
Come on up.
Quick?
I
Yeah.
apologize because I do have a terrible upper back spasms, muscle spasms. I can't turn very.
She makes you work too hard, doesn't she?
Well, I guess.
So, do you not mic up, so if you would use the phone, the microphone?
That's all right. I think I'm used to speaking for everybody. I know you do. See?
He already broke it.
Anyhow, I mean, I think you guys can hear me. I've been partners with Elaine for the last, I guess, 3 months, and
Yeah.
we worked together for a long time, and I've known her for probably about 2 years. I'm originally from Peru, and I came to this country back in 1985 and went to medical school through a program sponsored by New York Medical College. So I went to Guadalajara, Mexico, and then I went to New York to finish my 5th year of medical school. So I've been a doctor probably about 2 years and some months there. The attraction for the diabetes happened when I was in school, and ever since then I had a personal passion for diabetes. So I was doing a lot of diabetes education when I was a medical student. I was going back to Virginia, Washington D.C. area, and I attended a community clinic, which was more for poor people. So I did all the education there. Now, when I moved here from the East Coast, I decided to start educating the community. So I ended up in Las Vegas, where I sort of was hired by Alta Vista Hospital. Then in December this last year, we just broke up relationship. But I've known Elaine since before, and our plan of making a diabetes center for the northern part of New Mexico sort of started happening at the beginning of this year, and then hopefully now it's going to take off and be able to do that.